Welcome to the Heart Yarning tool. This website is designed for health professionals to help them engage in shared decision making with Aboriginal and Torres Strait Islander communities about heart health checks. It's designed to be used to guide conversations after the CBD risk assessment has been done to work out if a patient is at low, intermediate, or high risk. The structure of the website is shown here, and it's based on the Finding Your Way model, which was co-designed with Aboriginal and Torres Strait Islander communities. You can start anywhere in this circle, depending on where the patient is at in their heart health journey. For some people, a general conversation about their preferred ways of knowing, being, and doing, perhaps the role of family or friends, and other community support might be the most appropriate for that consultation. For others, they might need to take a break from talking about heart health and focus on other things. For those who are ready to engage in conversations about their options for heart disease prevention, there are specific heart disease information sections in options and weigh up the odds. And then there's some general guidance on next steps and decision-making processes. For this demonstration, I will focus on the options section and weigh up the odds. If there is a part that you'd like to print out for your patient, just use the normal print function in your browser or the print screen option. To make sure that the colours are shown in the same way as you see on the browser, you can toggle print backgrounds on or off, depending on how you want to print. So in options, there's a general introduction to either lifestyle or medication approaches to reducing heart health risk. There is a risk communication tool to explain how different options can reduce risk, in this case for someone at high risk. You can choose different options depending on whether they don't want to do anything right now. In this case, it's a 20% high risk shown, which means that out of 100 people with the same risk factors, 20 of those people will have a heart attack or stroke in the next 5 years. To reduce this, you can consider quitting smoking, which reduces the risk to 12%, or taking medication such as statins, which will lower the risk as well. Once the person is interested in more information about a particular option, you can go into the weigh up the odds section and either focus on lifestyle or medication for that consultation. For lifestyle change, they might be interested in discussing smoking, diet changes, or being more active. In this example, we'll use diet. You can go into more detailed planning tools, which have been shown in previous research to help people start to change their habits. So the idea of these tools is to guide a discussion where you can focus on a really specific thing that the person can change straight away. So in this case, the person often had unhealthy snacks when they arrived home from work. So they're going to focus on that moment. And some possible solutions could be listening to some favourite music or drinking a large glass of water instead of immediately going to that unhealthy snack. So there is evidence to show that coming up with these very specific plans can help people start to change their lifestyle. If you want to focus on a medication discussion, there are simple decision aids available in the medication section for both cholesterol and blood pressure medication. And for those who want more detail, you can go into a more detailed version of the decision aid. This will show more detail about the numbers from the research around the benefits and side effects of different medications to help them weigh up that choice. Finally, if you want just a general summary for the patient to take home, there is a 2-page summary you can download from most of the web pages. So that will just give a summary of their risk category, the things that contribute to their risk and what they can do to improve their heart health, as well as those finding your way components to guide further discussions. So these are based on that circular diagram at the start of the website. And there's also a question prompt list to help people think about what else they might like to talk about either at the next consultation or with another health professional. So we hope this helps you in your consultations about heart health checks and welcome any feedback you might have.